On July 28, Sichuan Province, located in southwest China, issued an emergency notice in response to a COVID-19 outbreak, asking to improve the prevention and control of the pandemic. All people entering the country through Sichuan customs are required to complete a 14-day centralized quarantine, followed by a 7-day home quarantine. The Chengdu Municipal Health Commission of Sichuan Province stated that on July 28, 3 new local cases were confirmed in Chengdu. The infected individuals were a family of 3. However, due to a lack of transparency, the data from the Chinese authorities was widely questioned by the public. Immediately afterwards, the local state-run media in Chengdu published an article asking the public not to believe in rumors, not to spread rumors, and not to create rumors. Previously, the focus of China's pandemic control was Nanjing City of Jiangsu Province. Nanjing now has 40 areas at medium to high risk of an outbreak. From July 20 to 27, a total of 153 confirmed cases were reported in Nanjing. The outbreak in Nanjing started at Nanjing Lukou International Airport. Since July 20, the outbreak has spread to more than 10 localities in 5 provinces, including Jiangsu, Anhui, Guangdong, Sichuan, and Liaoning. Nanjing authorities announced on July 27 that the strain currently causing the outbreak is a Delta mutant strain. Ding Jie, Deputy Director of the Nanjing CDC, said the mutant strain is highly transmissible and spreading rapidly. A video showed that the Nanjing government is using 240 excavators to level a hill. People suspected that it was an action to construct Fangkang Hospital, a name used to describe the field medical facilities to host massive numbers of patients infected by the COVID viruses. But officials denied it. On July 28, officials in Suzhou City of Jiangsu Province demanded a full suspension of road passenger transport routes to Nanjing City, including custom passenger transport passing Nanjing. In the meantime, tourist charter buses are not allowed to pick up or drop off passengers in Nanjing. The authorities also suspended the rental car and online taxi services in and out of Nanjing. On July 28, in Nanjing, over 2,300 retail pharmacies were prohibited from selling antipyretic, cough, antiviral, and antibiotic drugs.
你看个小娃子呢，头上得的胖胖的。
那个肯定是吃的。
你看看，你看看，老奶奶头上是得的胖胖。那我们就住在路边上哦。
天都亮了。
马上天都亮了。 这边还有一个小孩在睡觉了，你能看看这边的人山人海，公交车把我们送到这边，然后我们全部就在外面淋雨。我们带了18个月的小孩，还有一个8岁的小姑娘，就淋湿了，全部都湿透了，从头到脚。这叫把我们带出来隔离吗？
As the outbreak in Nanjing continues, other regions are beginning to break out as well. In the official notifications from various provinces, cases associated with Nanjing were disclosed. However, cases unrelated to Nanjing outbreaks were largely covered. For example, the government of Sichuan, a province in southwest China, Anhui, a province in central China, and Liaoning, a province in northern China, all attempted to blame Nanjing for the outbreaks that happened in their region. Some analysts have suggested that outbreaks in other provinces may not have been caused by Nanjing's outbreak. But because the Nanjing outbreak was earlier, the authorities of other provinces used Nanjing as a scapegoat for the new round of outbreaks. In Sichuan, a reporter found that an area in Chengdu has been closed off. In the meantime, the neighborhood where the infected person lives and its surrounding area has been under security control. Chengdu citizens were asked to receive COVID-19 nucleic acid testing overnight. Local police said that the district permits coming into the area but not going out, as it has been determined that there are suspected cases of COVID-19. It's the afternoon of July 28th in Chengdu. Yesterday, a new case was found. Across from me is the nucleic acid testing site. Now people are lining up for nucleic acid testing. There are still many people lining up behind, despite the very hot weather today. On July 28, a woman in Chengdu went out for a run and found that the neighborhood was closed and she could not go home. A large number of people were waiting in line for nucleic acid testing at Uppercut Road Plaza. A number of people in line said they were notified that there were a suspected case. The notice required that all mall personnel could not leave the plaza after work and must undergo nucleic acid testing at that time. Those who had already gone home were also called back for testing. Other cities in Sichuan, such as Mianyang City, a third round of mass nucleic acid testing was ongoing on July 28. Due to the sudden outbreak in Chengdu, Sichuan, fear of food shortages has increased, partially because the Chinese Communist Party authorities have been covering up all the time. People have been buying up all the vegetables and meat from supermarkets in a short time. There were few vegetables left in the market stalls and hardly a piece of meat in the butcher stores. On July 28, Sichuan authorities issued an emergency notice requiring the region to be divided into 4 priority levels based on the severity of the epidemic, which includes a containment area, a control area, a risk area, and other areas. In the order of the containment area, the control area and the surrounding area take multiple rounds of nucleic acid testing. In the quarantine area, the fully closed management is implemented. No one would be allowed to leave the house. The controlled area only allows personnel to come in, but no exit. Life-sustaining activities are allowed, however, gathering is strictly prohibited. Surrounding areas of risk prohibit all kinds of large-scale activities. Theaters, dance halls, game halls, and other leisure and entertainment places will all be suspended. The model of the Chengdu pandemic control includes road closure and community closures and centralized testing. These 3 steps are in fact the core content of China's pandemic prevention and control.